Hi everyone, my name is Michelle Tu. I'm a PhD candidate at the Center for Health Policy in the Melbourne School of Population and Global Health. I'm part funded by the NHMRC Center for Research Excellence in Total Joint Replacement, which we call OPUS for short. My thesis focuses on maximizing the use of longitudinal data to better understand the longer-term consequences in terms of both costs and outcomes of diseases such as cancer and osteoarthritis. In the era of big data, linked population health administrative data sets are increasingly used as sources for health economic research, allowing researchers to move beyond traditional research methods to better understand population characteristics, outcomes, and pathways of care. The aim of my thesis is to demonstrate ways in which we can maximize the use of linked data sets in health economics research to support health policy decisions. I use longitudinal data from the St. Vincent's Melbourne Arthroplasty Registry, which we call SMART. It is a rich data source that captures clinical and patient-reported outcomes in all patients undergoing elective joint replacement at St. Vincent's Hospital here in Melbourne. Using this data source, I examined the differences in long-term quality of life trajectories among total knee replacement patients and explored the potential use of these trajectories to optimize patient outcomes and guide value-based care. Osteoarthritis is extremely common in the growing elderly population, and joint replacement surgeries have been proven to be effective procedures, resulting in decreased pain and improved function and quality of life. However, studies have shown that up to 20% of patients don't gain clinically meaningful improvement after surgery. Therefore, strategies to identify patient subgroups most likely to have poor outcomes are needed. So my research explores the use of patient-reported outcomes, such as quality of life, and to correlate these with patient characteristics to help clinicians track progress and identify patients who are unlikely to obtain the maximum effectiveness from treatment. The finding from my research suggests that there are important differences in longer-term quality of life outcomes among total knee replacement patients, which indicates that not all patients benefit from the surgical procedure the same way. For example, we find that patients with comorbidities such as diabetes and mental health disorders do not achieve the same level of improvement in quality of life after surgery compared to those without these comorbidities. So this might mean that for these patients, the prescribed standard surgical treatment and follow-up plans are unlikely to be adequate and may need to be personalized. Because of the rapidly growing rates of utilization and large costs associated with joint surgeries, the judicious use of scarce healthcare resources is ever more important to ensure sustainability of our healthcare system. Therefore, it is important to target those who we can maximize outcomes and improve the value of care. The registry has recently completed successful linkage to Medicare, which captures all healthcare utilization, primary care services, pathology tests, and medications of patients from the registry. This has allowed me to extend my study to explore the patient's healthcare utilization over time and to understand the differences among the studied population and the potential associations of these to their quality of life. So this work will help contribute towards facilitating value-based care and high-quality patient-centered care. As a PhD candidate with OPUS, we're given the opportunity to apply for an OPUS Travel Grant, which provides students funding to travel and present at an international conference. Travel grants provide PhD students the support for opportunities to engage with an international audience and to obtain feedback from experts in the field. It also represents an excellent opportunity to experience different academic environments. As a PhD student, we usually have limited funding to travel and disseminate our research findings, and also limited opportunities to increase our exposure and establish international collaborations and networks. So I find that most universities are quite open to visiting academics, but it's usually quite difficult to secure funding to go. Therefore, travel grants can support such opportunities. The experience of applying for this particular travel grant is also useful as it was a good practice for applying for competitive funding and also a valuable skill to put down on my CV. Recently, I was lucky enough to be awarded the OPUS Travel Grant, which allowed me to travel to Europe to present my work in the International Health Economics Association conference in Basel, Switzerland. The conference is a leading conference in the field of health economics, and it was an extremely valuable experience for an early career researcher like myself to be exposed to. It was quite an experience connecting with eminent international researchers whose names I've come across in many papers that I've read. It was also a fantastic way to learn about other interesting areas of research that others are working on, and also on current methodologies. On the same trip, I visited the University of Oxford for a scholarly visit where I was invited to work on an orthopedic cost model project with an international collaborator. This was such a valuable experience, and this work allowed me to gain exposure working with an international researcher at a prestigious university, and the collaboration represents a possible extension of my PhD research. I was also able to present my work in a seminar at the Health Economics Research Center in Oxford. It also gave me a taster of what other academic environments are like in other institutions outside of Melbourne. So funding from the OPUS Travel Grant allowed me to maximize my travel overseas, supporting a valuable extension of my travel beyond the conference attendance. I'm very grateful to have the opportunity to apply for this particular OPUS Travel Grant, and I would like to thank the committee members for considering my application and for awarding me this particular travel grant to allow me to travel and get myself exposed and disseminate my research findings. Thank you.